Good afternoon and welcome everyone. My name is Courtney Tacker and I'm the Director of Local Initiatives with the California Interagency Council on Homelessness. I'd like to thank all of you for joining us today. We're excited to see so many in attendance for this webinar focused on including people experiencing homelessness in disaster preparedness. Health emergencies such as COVID-19 have resulted in lessons learned across many communities as they plan and prepare for an inclusive response to future disasters. The webinar today will highlight the lessons learned from one community to strategically addressing disasters and emergencies affecting people experiencing homelessness, with a focus on cross-system collaboration and partnership building. In California, natural disasters and emergencies are inevitable as we continue to experience disasters such as extreme heat and wildfires. CalICH will continue to lift up local examples and share forward information and resources to support communities as they plan and prepare for these disasters and the needs of people experiencing homelessness. At the end of this presentation, there will be an opportunity to post ideas for additional resources that would assist your community in planning and preparing for future response. We want this information to be useful to you and look forward to your feedback as to what may be most beneficial. There will also be opportunities to ask questions and engage throughout the webinar, and we encourage you to do so. I want to sincerely thank you all again for being here with us today and for the work that you do every day. I will now turn it over to Brina Silv to get us started this afternoon and introduce our presenters.
Thank you, Courtney. So to get us started, we have a couple brief housekeeping items. First, this webinar is being recorded and will be made available on our website following the presentation. I have also enabled live transcription for those who need that. Also, please note the attendees' cameras and mics will be off throughout the presentation, so please use the chat function for any questions or comments. The chat will be monitored throughout the presentation, and we will have time reserved at the end of the webinar to answer as many questions as possible. So we would like to get to know who is joining us today. So in the chat, if you could please type in your name and your organization, let us know who is joining us today. I'll give everyone a minute or two to start doing that. Thank you for joining us, Tristan, Keith, Tammy, Megan, Jenna. I see Juan. I see Jamie. Thank you, everyone. Really appreciate that. And then I also have a poll question here. Let me go ahead and launch that. Just asking, what type of organization do you represent? So it should be up on your screen. I have the homelessness response system, local emergency response, state response system, or other. I'll give everyone a minute or two to answer that. Okay. Looks like everyone stopped responding to that, so we'll go ahead and end the poll. So I see here we have a very diverse audience today. We have 29% here from the homelessness response system, 46% from the local emergency response, and 17% from the state response system. Great. Thank you everyone for answering that poll. And then for our agenda today, or I'm sorry, our presenters, let me go through that first. So our presenters today are Lucy Kasdan and David Motersbach of Alameda County Healthcare for the Homeless. Lucy is the director of ACHC and David leads grants and special projects. We'll also hear from Nena Garcia, the local homeless program specialist here at California Interagency Council on Homelessness. And now for our agenda. Here's our agenda for today. We will go over inclusive response, preparing for the needs of people experiencing homelessness, and then learning from a local community, a presentation from Alameda. And then we will also go over additional resources for disaster response. And our first presenter today will be Nena Garcia here at Cal ICH. Nena, I will now turn it over to you.
Thank you, Brina. Hi, everyone. Again, my name is Nena Garcia, and I'm from Cal ICH. As mentioned previously, the webinar today will feature experts from Alameda County Healthcare for the Homeless. They'll be sharing insight on emergency and disaster planning to meet the needs of people experiencing homelessness. And as we begin the presentation and learn from a local community's experience responding to emergencies and natural disasters, it's important to acknowledge that communities all over the state are working diligently to meet local need as California continues to be affected by natural disasters and health emergencies. As communities brace for these potentially life-threatening situations, it's critical to be inclusive of the needs of the full community, including people experiencing homelessness. Individuals and families experiencing unsheltered homelessness are in crisis and have increased vulnerability to these fluctuating and dangerous conditions. Planning that is inclusive for the most vulnerable populations allows systems to respond effectively and increases recovery capabilities. The U.S. Department of Housing and Urban Development developed a disaster recovery homelessness toolkit that highlights 3 distinct phases for inclusive planning. Those are local planning, response, and recovery. Inclusive planning broadens the scope of partnership and accounts for all community members, including people experiencing homelessness, within emergency communications and community mitigation plans, and assures that the needs of all community members are addressed. Inclusive planning supports strategies that help communities recover and rebuild to meet the needs of all residents. The Disaster Recovery Homelessness Toolkit, along with all other additional resources, will be shared out at the close of this webinar. I will now turn it over to Lucy and David to share their experiences and promising practices.
All right. Good afternoon, everybody. My name is Lucy Kasdan, and I'm joined by my colleague, David Motorsbach. And I will just say, as we kick this off, we are just thrilled to be here today. This is a real passion of ours, and really we're excited to be invited today to share with all of you some of the lessons learned from our work here in Alameda County. Next slide, please. As was really noted in the overview around kind of just the inevitability of natural disasters in our community, of course, I think it's always important to lift up just you know, that's why we're all here today, right? Is the impact, the disproportionate impact on you know, our most vulnerable, in particular our homeless population, and how so often, right, in all disasters, rarely are the needs of the homeless and the voices of the homeless really brought into that conversation. And so we are really hoping to be able to do today is to talk with you about how some of what we have termed here daily disasters, and kind of talk to you about some work pre-COVID that we've done here in Alameda County, how that really helps set us up and inform us for our response to COVID and our continuing work responding to the disasters that disproportionately impact homeless folks. I think for us, it's really kind of built upon community resiliency, the expertise of those with lived and living experience with homelessness, really informing our work. And I will say our hope for today for you all, from big counties, small counties, is that we really are able to share some of our work in a way that gives you all, leaves people with practical tips, ideas for ways that you can connect with grassroots folks all the way up to, you know, to your public health department and other kind of government agencies. Next slide, please. All right. So as I noted, and I'm going to kind of walk through a few of them here, really it was these past experiences that really led us to be prepared for COVID-19 and to really build upon that network. So again, hoping that you all today can hear some of that and think about what are opportunities to build on. And maybe they already started during COVID for all of you or prior to COVID, but how do you build on those to really be able to build a system that is responsive and meets the needs of the homeless community. Next slide, please. All right. So as many of us here on the call know, just the experience of being homelessness and just the basic needs of survival every day, the unpredictability, the instability of living in environments where you may be, where abatements are taking place, where there are rat and other rodent infestations, just the daily needs of survival and really the experience of being homeless in and of itself, being a disaster of sorts. And then as we add on all of the other things that come. So just really wanted to start with kind of grounding around just the trauma of that daily experience, but also, as many of you who are directly out on the grounds and work with folks see, right? There's also a lot of resilience, a lot of ingenuity, a lot of capacity, and that's where it really is bringing in those voices to help inform and not having us come in and tell folks how to best take care of themselves. Next slide, please. All right. So for us here in Alameda County, I think a lot of this really kicked off when there was the hepatitis A. Some of you may remember starting in 2017, there was a hepatitis outbreak that started kind of down in San Diego in Southern California and among folks who were living out on the street. And there was a lot of fear about it kind of coming up, moving up the coast here. And so we looked around with our public health department and really trying to figure out how to develop a strategy to respond. And so, and realizing that in order to go out and build trust with those that we needed to get information out to, and then get them to agree to accept, right, to understand the importance of it and want to take the vaccine, it really called upon us reaching out to and starting to build networks among who has the trust with our with the folks living on the street. So I think a perfect example of this is we created a flyer. I didn't show it here, but we created a flyer, and our community consumer advisory board and other folks with lived experience looked at it and said, no, all wrong. They created this flyer, right? They created this flyer based on the information that they thought was most important and the visual that they thought was most, the most effective way for us to get out that information. And then we organized to actually have public health nurses go out with trusted people. So whether they were community activists, whether they were more formal community outreach workers or leaders, right? Natural leaders within encampments and other spaces, to go out, meet with them, to be able to provide, as that entrance in, to be able to engage with folks and provide the vaccine. And so really, this was the starting point of us really thinking about how do you effectively respond, bring in the voice of those that we serve, and really be able to reach out effectively to prevent, in this case, an outbreak, which we thankfully did here in Alameda County. Next slide, please. All right. Several years later, this was followed by a pretty significant fire that took place in a housing site here in Alameda County. And really, we walked in the aftermath, and it was a housing site for individuals experiencing homelessness. And we walked in and saw the Red Cross and them really overwhelmed with the needs of the homeless folks that had been displaced by this fire, well over 100 individuals, and seeing that them struggle, right? And I think, again, nothing against the Red Cross, but I think really us understanding, right, and working alongside the homeless population and with our community partners here, knowing how to actually come in and provide services in a way that was trauma informed and understood the needs was much more effective, right? And so in that, I think, was another experience of really, for us, building up, really realizing that other systems, right, systems that respond to all types of disasters aren't built around the needs of homeless folks. And so expecting the Red Cross or other agencies to step in and be able to really support our community is not realistic. And so we really needed to step in and play that leadership role. And just wanted to call out, not only, of course, was this large fire really another driving force for us, but also, as I'm sure is true for many of you, we have hundreds and hundreds of fires a year in encampments in our county. And so another approach that we've been really bringing in coordination with our community partners is really taking that framework around understanding from folks living outdoors, what are the reasons fires happen, right? A lot of it's around cooking, the need for light, all of these things, right? So so we really took a much more harm reduction approach. What are things we can help distribute, like fire extinguishers, like solar lanterns? What are tips that we can talk with folks about moving their cooking so it's in a safer place? Next slide, please. All right. And of course, extreme weather, which we see more and more of now. And again, another area where the advice to the general public, whether it's heat, and we'll talk about in a minute, whether it's a heat emergency, a smoke emergency, is go indoors. And of course, that is not an option for our folks that live on the streets, lives in RVs, live in cars. And so really being able to build a network that we've been able to do here in Alameda County, where with notification out around weather emergencies. And this also, I should note, includes flooding, which has become an increasing challenge. How do we get information out to our network of peers, of partners, to make sure that as we know when these things are happening, that we're able to kind of activate a response, so to speak, to go out to our folks we know are most vulnerable with the most complex health conditions, and be able to bring them indoors for the duration of whatever that emergency is. And you have to know where the folks are on the ground and have that relationship with them to be able to do that. So again, thinking about how you work within a county structure, and then up with your community partners to really be able to build out that response. Next slide, please. All right. Another one of our lessons learned, and all of this you can tell is kind of leading us up to COVID, was around air quality, is of course around wildfires and the need to be able to rapidly distribute masks to folks who are outdoors and unable to escape the poor air. And so in the early days, it was okay, 5 or 6 people running around giving masks. And as David will talk about in a minute, he was really able to bring together and convene and cast the net wide in terms of who is out there, who has the trust with folks living on the street. So where we may have been able to distribute a few hundred masks in a few days, now we can distribute thousands and thousands of masks in just several days through this network that is activated, that can quickly go out and distribute supplies 7 days a week. Next slide, please. All right. And you can't talk about the daily disasters within the folks that we care for without talking about overdose deaths. And of course, this is something that happened, that happened prior to COVID, definitely increased due to the isolation that happened in COVID. And for us, as we continue to utilize these networks we have created to really, how are we amplifying the work that we are doing around Narcan training, access to Narcan, and other interventions to prevent overdoses, really utilizing some of those networks to support preventing overdoses as part of our disaster response, daily disaster response. Next slide, please. This slide is meant to overwhelm you. This slide is a lot of information. It's going to be included in the notes. Obviously, we're not going to go through all of this, but we really wanted to include our response to COVID-19 in our discussion around daily disasters, because all of this work, starting with Hep A, then with wildfires, and fires in housing projects, all of that really led us to a place where, when the COVID-19 pandemic started, we were ahead of the race. We had this network, this foundation of trusted people that we worked with. And when I say the kind of community we work with, it's everything from the churches that pass out meals to more kind of activist groups, to formal partners, who provide homeless work, to our great partners in our public health department, EMS, etc. So really that full continuum. But because those relationships were there, it really allowed us to quickly get out information, get out initial supplies, and then build upon that. And so this is a lot of information, but I think we wanted to, just for those who are interested in looking at it afterwards, to really see all of the different steps that we took as part of our COVID response. And David's gonna kind of talk about the lessons learned from that on our next slide, and I'm going to pass it over to you, David.
Thanks. I guess we can advance. Yeah, I'm David from Alameda County Healthcare for the Homeless program. We are an interesting program. We are a HRSA-funded health center program focused on people experiencing homelessness that is based in our local health department. So just by our existence, we bridge make a lot of bridges that a lot of people don't, or places don't really have. So we're able to connect with FQHCs directly, with the hospital and healthcare systems, the countywide systems, with our public health, our emergency response programs, and with providers and people on the ground, and our patient population of people experiencing homelessness. So we've been really lucky to be able to take advantage of that position to do stuff like Lucy was mentioning, and then now connecting with our national partners, other healthcare for the homeless programs throughout the state and throughout the country to get together this spring and figure out what are some of those lessons we learned from our COVID response that we can kind of put together and share with you all. So we developed some of these key areas that we thought were really important. And we're going to walk through those right now, starting with our community, and most importantly, our community partnerships. Brina, if you can advance. So like Lucy mentioned, we developed a horizontal community partnership without even really knowing it at first, just through the fact of walking in and engaging in these daily disasters, these smaller level emergencies that weren't necessarily planned for on the higher level of emergency response. By our engagement and our work on that over the last few years, that put us in a position to be able to convene a community of response, and specifically to COVID, that I think is going to will inform our future emergency, climate, et cetera, disaster responses. And of course, the first part of that is so critical is being trusted and engaging trusted messengers to carry out your message, our work. Or to carry out part of our work. So when COVID, just like many of you all, when COVID first emerged, February, March, by the beginning of March, we had created a weekly telephone call, started out as a telephone call and quickly became a Zoom call. We cast the net widely. We said, anybody who's in the homeless system, whether they're shelter providers or outreach providers serving unsheltered people, come together with us and we will help provide consultation, advice, and information. And, in those beginning days, nobody knew really what was going on. So we did a lot of just listening. What are the problems that you're expecting? What are the questions that you're having? And what can we all do together? As well as providing that information directly to folks on a regular basis. That was like 2 different phone calls a week with outreach and shelter providers. That became a permanent fixture, I believe, in our program. It's been a COVID community call ever since, with up 70 to 150 participants each week on that call. And we found out, really importantly, how important it is to provide tangible, useful things to your community, to that community. That engages people. People feel like they're part of something, and there's a reward as well that helps create that network, that engagement. We used some of the things we learned from the mask distribution during the wildfires to realize that it wasn't going to have to be up to us to do all this distribution, that we could set up networks, different sites, different centers where people could come and pick up equipment and supplies. So we were giving out all that PPE, masks, and then eventually COVID tests, bottled water. And we used that convening and that community of response to really be able to effectively coordinate, first of all, our COVID response to outbreaks, to share isolation and quarantine information, to bring people together really tight on how to use our I&Q system. And then that carried off into contact investigation, bringing our public health department into that to be able to talk directly to the communities of providers around contact investigation, and then vaccination, and throughout all that time. And now we're at a place where we're working with that same community to help them preparing for upcoming surges, talking about stuff like ventilation and their roles in being able to prevent surges of disease. So throughout that time, we already had some trust. People already trusted us. And that trust was really built up through our kind of honesty when we didn't know the answers to things, and then going out and finding answers and working with our communities to keep working on our response, our communication, our messaging, and keep moving forward in that way. So that's the really most important basis there. And moving on to the next slide was integrating healthcare and support services in sheltered, unsheltered, and housed sites. This is something that we were lucky to have already be working on our county level. Our healthcare for the homeless program, our way of doing services is bringing medical care out to where people are, bringing behavioral healthcare services and support services, social services support to where people are. And we found that already having that and then expanding that through our partnerships with services providers, with shelter providers during the COVID crisis, we just kept on building the placement of care and support disseminated throughout the communities. And by having that gave us multiple platforms to be able to quickly turn around services and bring people in a lot easier to responding to the kinds of emergencies that happen on the daily basis that we've been talking about. We're continuing to push and further develop that service. You know, one of the things that happened during these last 3 years is, and this is a whole separate webinar, was creating a system of street health teams that went out throughout each zone of our county, focused on providing street-based healthcare services to unsheltered people, and focusing on shelter health, what's happening in the programs, not just the homeless shelters, transitional and housing programs, but service centers, drop-in centers, food service places as well, to help develop and build capacity and standards around making those locations healthy locations. Through that work with us, they're more and more part of our network, our response and our emergency response network. And then referring to the importance of harm reduction, overdose prevention, and helping incorporate that into shelters and programs. All of that gives us a lot more reach than if we were trying to fix everything ourselves from the top down. Next slide. Along those lines, one of the things that we learned that was so important during COVID was how effective and helpful the implementation and development of virtual care, telehealth, is not just for housed people, but for people in shelters, in encampments and permanent supportive housing. We were able to both expand and see the expansion of virtual care. And that was another really important way it goes two ways. People that are generally excluded from care were able to get into care a lot easier and a lot quicker. In a lot of our clinics, the no-show rate just plummeted. People were able to connect directly for services. And we feel like in an emergency, another type of an emergency situation, this will be a big strength of our response and our ability to protect people. The other way is that we're able to communicate with patients. They're able to communicate with us. We're able to get a lot of people connected to phones. And we developed, one of the things that we distributed a lot of was solar power batteries that people are able to use to recharge their phones, to stay in contact, to have that contact with folks. Really important element to consider in your planning and your work. Next slide. And also super important, also part of that trust, also just part of being able to know your population and work on that and create that trust is advocating for change and support people that are advocates for change. So racial and population equity is baked into our work with people experiencing homelessness. As we all know, people experiencing homelessness are much more likely to be racial and population minority groups. And that has to be kind of taken into account and really explicit. We really had to look into who is being served in our current systems, in our current emergency response systems, and who's not being served, and adjust those partnerships. It was really important for us to work with advocates, people that were traditionally against us, against the county, against the cities, that were fighting for people's for homeless people's rights and stuff. And we worked directly with those and found out that was a huge area when we built those partnerships and that trust. That was a huge area to be able to get work done. We did hire and staff with lived experience to be part of our kind of frontline responses to work with folks experiencing homelessness. And we continue to build those approaches. It's really clear that the residents, the unsheltered residents, and the advocates that are working and fighting for them, they often know best who are the most vulnerable people that are out there, and they can guide us and direct us to the people that are most adversely affected during a time of some sort of emergency. Moving on. Oh, I also wanted to just in this as well. One of the really huge kinds of disasters, emergencies that we have to deal with, and that we know that like Humboldt County, Orange County, LA, Sacramento, San Jose, Oakland, almost every major county in or populous county in the state is having to deal with encampment abatements and closure. And that's a tricky place for us. It's always a fine line that we have to walk to be able to be able to step into situations that are often that are disasters for the people that are affected by them, but that are very political and touchy situations. And sometimes we need to advocate for the needs that are expressed by consumers and by advocates around us. And that can help us be able to really meet the needs of the people that are displaced. I'll move on to the next slide because part of that advocacy work is bringing in people with lived experience and communities that you're not necessarily used to working with in your planning for climate emergencies. So we Healthcare for the Homeless program, we were lucky enough to already have a community consumer advisory board. And throughout COVID, like Lucy mentioned before, throughout this process, they've been able to weigh in and help guide us in our responses to these many different kinds of emergencies, and give us feedback on what we're doing, on how we're doing things, what our messaging looks like, what our flyers and how our partnerships look. And in the last year, starting about a year ago, our consumer board has been very interested and focused on climate change and the ability of our county and our our county, our state, and our local emergency responders to prepare for climate-related emergencies. So this little chart right here is just mostly an example. I'm not going to go into super detail about it, but of the input and a set of recommendations that we developed by carrying out focus groups with unsheltered people. And that wasn't just our community board, but our community board recruited people from different street and shelter settings to come and do a larger process to plan and give input on and identify the different kinds of emergencies, climate-related emergencies that people experiencing homelessness, both in shelters, in cars, and in on the streets, will be facing, and what are appropriate recommended responses that the county should be that our county level responses should be working on. And so this is an example of some of those ideas that they brought forward. They put a lot more detail into that, and we'd be happy to share their larger recommendations with you all. But yeah, starting to plan the specific interventions that are going to be needed for these types of impacts on people experiencing homelessness. We can move on to the next slide. How are we doing for time? Brina, we've got just a few slides. I think we're okay.
You got about 7 minutes.
Perfect. And then back, so that most important, that going with our idea of working with the grassroots, working horizontally with the advocates, with the providers that we work with, of all types and sizes, and the homeless population that we work with for that planning, then moving up along from local agencies. In our case, there's a lot of work that needs to be done with cities. There's work needs to be done with counties, with our public health department, with bringing in behavioral health, environmental health, our housing system, our continuum of care, the providers networks, and working our way then up to emergency response, the OES, Office of Emergency Services, and then where we get into the Red Cross, state emergency responders. There's that upwards work that we are working on. We're all working on a work in process. And as Lucy and I really want to keep reminding people, what is an emergency, what is a disaster, really varies according to your point of view and where you are. And there can be, and there will be, emergencies and official disasters and very well thought of hierarchy of responses and protocols of responses for a declared emergency. But when it gets to the kinds of emergencies that focus more on vulnerable populations, and it's not just people experiencing homelessness, it's immigrant communities, non-English speaking people, disabled people, seniors and aging people. There's communities all over that don't necessarily have or fit into traditional top-down disaster response, who are disproportionately affected by these daily types of disasters, heat waves, cold waves, et cetera. Those partnerships are, and developing a definition of emergency response. That's work that we're in the middle of right now. And doing the work like now, developing what are the conditions, what are the resources that we have, who can we count on to partner with in the development and in the response to things. Yep, that's pretty much that slide, and we can move on to what I hope is the last slide. continued. So we're doing a lot of work, focusing a lot of work on helping providers develop their own specific plans for their own specific populations. We feel that's important. We feel like it's really important for counties, for cities to figure out who can best talk to those, who's in a best setup to be able to communicate and talk with populations in that way. We were lucky to be able to be in that role because of our work, because we stepped into doing a lot of that work. And we'll share a couple resources later on, but one of the resources that I wanted to include in this is a resource that I think you have to click on the link when you get it. But it's really looking at behavioral health, the role of behavioral health in planning specifically for vulnerable populations for disasters. And that was, we feel like that resource that is done by, I think, the American Psychiatry Response to Climate Change or something, is really helpful. It gave us a lot of ideas of what can be done and how to inform the work that you're doing with vulnerable populations, subpopulations. I mentioned the different approaches to climate emergencies. Something that we're working on right now. Is it appropriate to imagine one big heat, for example, heat or cold respite center where everybody in your geographical area is supposed to go to in the case of an emergency? Or should we be planning on more decentralized, smaller respite centers in case of heat, cold, or other types of emergencies? How can you use those networks of care that you already have to be able to then more quickly and elegantly pop up small responses that might be more suitable for a not one-size-fit-all response? And yeah, super important how you share that information. For us, one of the critical ways was face-to-face on Zoom meetings, face-to-face by distributing supplies and resources, by creating guidance directed to specific populations, and by seeing them where they are in the field with our boots on the ground. So that's, I believe, our last slide, and I think the last slide is a resource list. Yeah, this has got links on it for that. Those behavioral health strategies, I think, super important to look at. Stuff from the CDC, and I want to put a shout out to the National Healthcare for the Homeless Council. And that's projects that we're working on with the National Council to really focus on the role of people experiencing homelessness in climate and non-climate related emerging emergency responses. I guess that's it from Lucy and I.
Yes, and that's the link to your website, and all of those links will be available in the materials that we'll be sharing at the end of this presentation. So thank you so much, both of you, for sharing your experience and your expertise. I thought you brought up a lot of great information. And we do have a couple of questions that came in, but one of the things I really wanted to highlight as we get this conversation going is that the vulnerable populations do include people experiencing homelessness, but there is a lot of different populations within our communities that are vulnerable, and there's a lot of intersectionality between those different communities and populations. And so the type of support that would benefit and really care to the needs of people experiencing homelessness is something that could be spread across and really is a best practice within those planning and response and recovery efforts that leaders and communities are doing across the state. And so to get us started, our first question was, are there partnerships outside of the homelessness system that are part of your network? So outside of the homelessness response system, are there other key community partners that have really benefited and are critical to your work?
I would just throw out our public health department, our local county emergency responders are really super important in partners in that. And what we're making progress on is, working with them, being part of their larger plans, and really playing that role in focusing on what is the role of vulnerable populations in that emergency planning and response. That's one, I think that's super important to us.
Okay, and could you expand a little bit on how, if there was a community that really hasn't made those efforts yet, or they're in the beginning stages of the partnership, and maybe they had a connection during COVID, but now at this point, as a community is deciding on a larger plan, how were those conversations started, or were you able to sort of leverage a certain kind of partnership with them at those early stages?
The first thing was just jumping into situations and not being afraid to respond the best that we could with the resources that we had, but being transparent and open with partners in that, with potential partners, looking to see who we would respond with. And not coming in a way of saying, look, we are the only solution, but we want to help respond. We want to be part of that, and being open with those connections is super important to me, and not waiting till you have the plans made up to jump in and the resources on your own.
Yeah, and I don't know quite what the questions, I don't know if the person wants to clarify more, but I agree. And I think, again, if right, partnerships that you made in COVID, and going back to the idea, right, that that was one of the beautiful things that came out of COVID, was it really brought people together in a way they hadn't been before, right? And so I do think it is about, for us, and that about how do you then continue that relationship in a way, right? And so that, I think, has been one of also the most effective things about, as David was talking about our weekly convenings and our kind of trainings, is continuing the momentum of people came together in a space and a time when nobody knew what was happening and everybody needed information, but continuing to hold that space. For us, it's that. It may not be feasible for you where you are. It may not be at a larger level. It may be that relationship between your agency and another agency that started with COVID, and how do you come back to that and look for what are other shared areas that you both maybe really care about, right? And to the question about, it may or may not be homeless organizations, right? And it is that piece around engaging with those that don't naturally think about homeless people, right? It's not their charge, but how do we work with them so that when they think about responses or think about their work, it does include those who are on the street.
I think, go ahead, sorry.
Oh, I was just gonna say, I mean, for us, and I think it's like, it is, the relationship is everything, right? You have to have the trust, get there on the ground. And I think now relationships are hard because they all happen over screens, but I think any opportunity that you have to go to sites, meet with people in person, be out there with them, bring, as David said, the resources you have to really build that partnership. I think that's how you start to really build up that system and cast your net wide in terms of who you are thinking about.
Yeah, it sounds like what you had mentioned previously in the presentation was that idea of advocacy. So no matter what space that you're in, you are advocating for that group that you are serving. So even if the system itself that is outside of the homelessness system isn't directly serving all of the time people experiencing homelessness, you in that space can advocate for that community to make sure that their needs are met. So thank you so much for bringing that up. And then David had mentioned the not one size fits all response. So what would it have? What would that look like? Could you tell us a little bit more on who you would partner with in that effort of a not one size fits all response?
I would say, like, the example of that would be in extreme heat planning. The go-to response in an extreme heat situation is to open up the Superdome and tell everybody, if you can't shelter indoors or use your air conditioning, come to the Superdome or whatever. And what we see is much more the way of the future would be disseminated, scattered, smaller respite centers for climate emergencies. And so what needs to happen, that needs to be driven. And I would say I would use some of the things that I really like about our public health department has been able to, during COVID especially, create contracts, put out an RFP with different smaller organizations, community-based organizations, and use a model of let's set up a system with contracts in place with smaller organizations so they can, number one, be committed, number two, trained, and number three, have the resources available to be able to, when it's possible, when it's needed, to be able to raise their own response. And that happened a lot during the way that our county was able to get testing, COVID testing and COVID response out on the streets, not just counting on the health department, but contracting with and training community-based providers so they could get that connection to different populations based on language or ethnic identity, et cetera, disabled or whatever. You can then focus those RFPs to get a diversity of the populations that you want to serve and have those folks identified and convened and ready to go. That would be the best case scenario to answer.
Yeah,
And how to get there is we're all going to have to work on that on our local level.
definitely agree. We have time for one more question. So what is the best way for therapists and crisis response counselors to show up to prepare this population before a disaster? What is their role during a disaster?
I'll just say something quick and then give it to Lucy because this is right up her alley. But one of the things we really counted on and shared a lot with our network of response was and continues to be the what's called Frontline Workers Counseling Project, which was self-organized in the Bay Area by essential like psychotherapists, professionals that got together and wanted to volunteer to support first responders. And they've continued to be an important resource that we connect our responders to. But Lucy?
Yeah, this is a great question. I mean, I do think, again, especially the piece about like, what is your role during a disaster? I would say that that I would really look towards, right, the expert. Like, I do think that sometimes, and I'm an LCSW too, so I feel like I can say this, kind of showing up as like the clinical expert, right? The behavioral health expert. I do think it really is about the fact that like, if you are showing up at an emergency situation, right? There's a fire at somewhere and you are showing up to support that, really looking towards the community, looking towards those again, that have the trust so that you can really understand. So you're not coming in as like the expert, but coming in and saying, I want to, be here and understand what your needs are and how I can best support them. So I think in the moment, right, really kind of showing up in with that stance, and looking for who the natural kind of leaders are and allies and people that you can build that trust with, in terms of kind of in the moment, sometimes when you get launched out to a site, right, kind of what to do. I do think in advance, I think really thinking about who are those people in your community? Are there opportunities? It's very hard to make relationships during a crisis, but are there others that work in this kind of response or potential response space that you can, reach out to and build those relationships with in advance? Because when you come into a disaster situation, having that trust and partnership with the other kind of formal providers, right, or professionals that are coming into this space is really gonna, I think, support just our collective effectiveness, in working with each other. So I would say, look for those opportunities. Again, it can be very small things. And I think that's what we wanted to highlight, right? The HEPA piece, we weren't running around with, but like, look for those opportunities of things that may not be so obvious as like, oh, this is an opportunity to start building out some of those networks and relationships that really, that's who you will call upon when there is a disaster. So, I would say that.
All right, well, thank you so much, both Lucy and David, for taking time today and sharing out. We have a few more slides left. Sabrina, if you want to go to the next slide. There's about 4 minutes left on the clock. And so we wanted to share some resources that will help support the work of equitable planning and response to health emergencies and natural disasters. Here we've included a list of resources that can support local systems as they prepare for different types of emergencies, promoting resilience, particularly with the inclusion of people experiencing homelessness. And this again will be available on the slides after the presentation. And then next slide, Brina. This slide includes the newly updated Access and Functional Needs Library from the California Office of Emergency Services. It lists resources on accessible and functional needs with best practices on effective communication, sheltering, and integration. And then our last slide. Here is a resource that can be directly shared with people experiencing homelessness. It was created in partnership between the California Office of Emergency Services, California Department of Social Services, and us, CalICH. The Disaster Guide for People Experiencing Homelessness lists tips for survival in the case of evacuation from a wildfire, flood, or earthquake. It also includes statewide emergency resources for individuals to connect to county updates on evacuation routes and shelter for people experiencing homelessness. And all of the resources we reviewed today will be available again on the presentation materials that will be emailed to attendees following the webinar. We'll also include additional resources that may be helpful as your community builds partnerships and helps increase local capacity to keep people experiencing homelessness and all vulnerable populations safe during emergencies and natural disasters. Now I'll hand it back over to you, Brina.
Thank you, Nana. And we want to thank you all again for joining the presentation today. Before we end, we would like to take a moment to hear from all of you. I have 2 quick questions. So in the chat, if you could please let us know what other topics on disaster preparedness and emergency response would be helpful for you in the future. I'll give everyone a second to go ahead and put their responses in the chat. Any future topics related to disaster preparedness and emergency response you would like to see or you think would be helpful in the future. And then before everyone hops off, I have one quick poll. Last quick poll. 1 second. Oh, there we go. What format for future resources would be most helpful? So for those topics that you're putting into the chat, what format for those would be most helpful in the future? I have toolkits, webinars, quick reference sheets, and guides. Give everyone a minute or 2 to do that. Thank you so much for responding. Okay, looks like I stopped getting responses. All right. Well, okay, so that is it for today's presentation. Thank you all again for joining us. A huge thank you to our presenters, Lucy Kasdan and David Moldersbach from Alameda Healthcare for the Homeless. As Nana said, we will be posting a recording of today's webinar on our website. You can see here, bcsh.ca.gov/CalICH. And here are our social media handles to follow for updates. Once again, thank you everyone for your time and have a good rest of your day.